Hey guys, Emma here. I just wanted to let you know that Mira and I had a particularly good time recording this podcast, and it is going to happen again. Nina has agreed to come on for a part two. Important before we start the podcast, just to mention that there may be some content that we talk about that could legitimately be, triggering for some people, because we're going to talk about things like post-traumatic stress disorder and trauma, not just to horses, but a lot of the language being used is also applicable to humans too. So keeping that in mind, there may be some triggering content, but it is wonderful. It's a really good episode. So yeah, enjoy.
Recorded in the beautiful mountains of British Columbia, welcome to
Friends on Horses.
Nina Ekholm Fry is Director of Equine Programs at the Institute for Human-Animal Connection at the University of Denver, where her work focuses on therapeutic human-horse interactions and on equine behavior and welfare. Nina has a background as a mental health practitioner, providing clinical services specializing in trauma treatment, as a competitive rider and equine behavior consultant, and as an academic professional actively engaged in national and international organizations for both human and equine health. She has a particular interest in applied ethics and social justice perspectives within human-animal interactions, including human-horse conflict and the experience of stress and trauma in both species. Welcome to Friends on Horses, Nina. We're so excited to have you here.
I'm so happy to be on. Thank you.
So I wonder if we could just kind of start talking about the research that's out there. Now, I know we, the three of us have spoken that there isn't a lot of concrete research about this topic, that a lot of it is a bit more speculative at this point. I wonder if you could expand on that a little bit.
Yes, so when we're talking about comparative health, and in this case, talking about the potential for a human mental health diagnosis, post-traumatic stress disorder in horses, the amount of research that's been done, interestingly, a lot of the research on trauma, stress, and fear have originated on other mammals, mostly on rats, and then, been compared to or related to human experiences, especially the more invasive parts of tracking changes in the brain and that kind of thing. But when we're now looking we're going back again to look at, okay, could we maybe apply diagnostic criteria or the understanding, especially of mental health diagnoses, on other, say, mammals in this case, like dogs, like horses. We're still, hard research on this is still emerging. We have some interesting studies relative to primates, such as chimpanzees. And there's also been a lot of talk, of course, about the experience of working dogs being part of military service and deployment, and their experiences of trauma. But overall, most of the research that starts mentioning specifically things like psychological trauma, post-traumatic stress disorder even, has been in relation to other mammals, rats, dogs, primates. So we're kind of in this realm now where I think it's time we really focus on horses.
Wonderful. They've done so much for us. It's nice for us to start thinking about kind of, the impact of our training and their social systems in our barns, not in, and on their mental health. I think that's wonderful. And for people who might not really understand what post-traumatic stress disorder is, I'd love for you to maybe clarify some of those labels for people, so that, because there's also, I feel like, some misunderstandings and stigmas around those words, and people don't fully understand them. So it might help people get through the podcast a bit if they really understand, what do these things mean?
Right, and you're right, Emma, in saying that there's quite a lot of labels, stigmas, perhaps misunderstandings. And in some ways, you know, when we have diagnoses, we then can also label, separate somebody, but we can also understand more and normalize perhaps more of these, what are actually evolutionarily helpful and typical features of experience of stress and fear. And again, I'll just use the word trauma. I'm referring to psychological trauma throughout this podcast, as opposed to physical trauma. But again, the experience of traumatic stress, which is really, it's an evolutionary fear response that really prioritizes in present tense our survival versus perhaps some of those adverse quality of life effects. So this is not something abnormal, a reactive amygdala part of the brain that's involved. It's not something that's now, oh, you have an abnormal part of your brain. No, you have an adaptive response to fear in this case. The evolutionary aspect of experience of stress and fear and then resulting trauma really relied more on, all right, you're having a really unpleasant body-mind response here. You're supposed to move away. You're supposed to leave. And those situations are supposed to be quite fleeting in nature, but still with these effects of avoidance. So we're supposed to maybe not go near that cave again, and some effects of hypervigilance, you know, be watchful, pay extra attention in certain situations. But it's when these features become generalized or become kind of heightened or on alert all the time, that's when we see the kind of maladaptive features of this, again, evolutionary normal or typical response that we can see in other species too. There's been studies on wild or non-domesticated animals and wild animals who don't live in captivity, like some birds, for instance, that have also shown some lasting effects of that moment of intense fear or the threat of danger. So that's also quite interesting. And, you know, in humans right now, we use diagnostic criteria that are generalized. And in the United States, anyway, we use a manual called a DSM. And it's the 5th edition now. And anybody can really go online and search and find out what's in that manual. There's another system called the ICD that's used internationally as well. But I'm speaking now from the perspective of the so-called DSM, the Diagnostic and Statistical Manual for Mental Disorders. And in the current edition, when we're talking about humans, and this is interesting because there's been studies who have applied the human diagnostic criteria onto another species, like in chimpanzees. So it might be interesting not only for us to know about trauma for ourselves, but also in terms of this comparative framework. So there's, you know, the primary idea is that you have been exposed to the threat of or the actual occurrence of something that to you felt that it, you know, threatening, horrific, that it might impact your life really badly. It doesn't have to be, oh, I think I'm absolutely going to die now situation, even though that's part of it. But a lot of times it doesn't have to be that sense of, oh, I think I'm going to die. It's, I'm going to lose a lot in my life. I'm going to lose bodily integrity. I'm going to lose mental integrity. We can compare it, for instance, to folks who are undocumented immigrants and are afraid of losing their ability to be in a certain country, where technically that's not a death per se, but it has this, you know, really heavy implications. So we want to make sure that the assessment of that, you know, horrific event really lies on the person, and another person can't make that distinction for the person. But it has to be, again, something that's really, it feels impactful and scary. And then there's 4 areas or 4 things that have been categorized into what we call clusters of the outcomes from having been exposed to this threatening or actual event, or the threat of an event. And they include things like intrusion or intrusive things. And some of these things are perhaps human specific, or we can ask other humans about them more easily than other species, such as having intrusive thoughts that come in and kind of grab your attention seemingly from out of nowhere. So in this case, there's not a reminder, smell, or anything. You're just kind of going about your day, and then you're gripped by a body sensation, a thought, something that's kind of can be quite diffuse, or not clear, or it can be like a picture emerging in your mind. It can also be things like nightmares, things that, again, you don't want to experience, and they feel like they're intruding on your mind. But this category also includes things like re-experiencing. And this is something that, whether you meet all the criteria, it's very tricky with these diagnoses, because we have to come up with something, but it doesn't mean that a person's experiences are not valid. And I think that if they don't meet every single one, or the criteria for that diagnosis, but I think a lot of folks have had the experience of, you're not just remembering or revisiting something. It's like you're re-experiencing it fully again. This can be a pleasant thing, like smelling something that you haven't really smelled since childhood, and you're like, wow. And if you had a good moment in childhood and you associate it with it, it can be a good feeling too. But in this case, the re-experiencing is related to the thing that was horrid and scary. And it can be a physical, visual cue. And here we can start making some comparisons where we can actually notice that, the horse is responding to a physical cue or reminder, an associated event or item, But it can also then, in terms of humans, what we know, it can be a thought, like you can be thinking about a topic, and all of a sudden something that's associated with that traumatic event kind of is associated with that thought, and you have physiological and mental reactions. So that's one category, it's intrusion. Another one is avoidance, so that you are starting to avoid things. For us humans, it can be a mental avoidance. Some of my clients say they build a corner, they put up barbed wire, they put up warning tape, and they say, I am never thinking about that again. I am never going there. It's too scary, it's too much. So it can be a mental avoidance, which we can explore as humans, especially in adults, but it can also be physical avoidance. So our kind of scope of physical movement narrows, and we are like, I don't want to go into city centers, or I don't want to go into the forest, or I don't want to go into, whatever association we have. And here again, some parallels can be made about say a horse avoiding something that in our minds, this is not really scary, or this is not really a thing, or this is something that you should be used to. You've seen this 1,000 times, kind of thing. So there's two more categories for the human diagnosis, which is what we're talking about, the alterations in cognition and mood. When it comes to cognition and learning, this is a major part of understanding trauma, because there's basically alterations in how the brain is now functioning around the fear memory. And some of these effects also are globalized, so they're not just about one thing. It can be difficulties in humans concentrating, relative to remembering, learning things. So this is where, when we're looking at the way that humans typically interact with horses, which is around utility, or us wanting the horse to do things that we want to do, that's where the interruptions in learning processes, or how the brain interacts with learning, becomes really relevant to this conversation. So it could be it's proposed that there's a disruption in the extinction of the fear memory. So that moment that's supposed to be fleeting, of that in a natural setting, that say predator or something like that, that came, now the mind can't let go of this image of this scary thing, the predator in this case. There's not an extinction of that memory, even though perhaps the horse was initially scared by the wheelbarrow, but now, because the wheelbarrow literally tipped on them or something like that, but now the wheelbarrow is just around, but there's not an extinction, there's not a neutralizing of that fear memory. So that's part of, there's literal changes in how the brain uses itself, or how the brain is used in these processes, as well as some changes to the structure and size of certain parts of the brain. So of course this impacts then learning. And then the second subsection here is mood, or kind of mental state, emotional state. And in humans we see, reduction, like being in a bad mood. Nothing seems really to be pleasant or pleasing. The things that used to bring joy don't anymore. And that is enough to really, affect one's quality of life. This feeling like, why am I not, everything feels like shit, literally. So the alterations, they're in mood can be not seeking out things, like less of that seeking circuit or being curious about things. We could make that parallel to other animals like horses as well. So kind of maybe more of what we'd call maybe a depressive state, because we have comorbidity with or concurring together with, say, an diagnosis like post-traumatic stress and major depressive disorder or depression, or when we go to the final category now, things like anxiety, that is quite common to go together with this diagnosis. So anyway, the final one of the four that I just went over has to do with arousal or reactivity. So the main thing here is that idea of hypervigilance, and it doesn't mean that human is literally, looking around, turning their head around. Same thing with horses. It doesn't mean that the horse is constantly like looking, but that they are constantly having an eye out or an ear out a little bit to the environment. What could be happening? I have to be tracking this. So an increase in that kind of scanning, tension. In humans, we see a lot of irritability as a result. We see a clear disruption in social relationships, which is a protective factor for humans, which post-traumatic stress disorder strips away due to the changes that I've talked about. And we might see something like this in horses as well. Also, exaggerated startle responses, where the horse is already in a tense state and then something small happens and the reaction is so big and it's constantly and consistently. So there's so much, it looks like there's so much effort, happening in that startle response, when it seems to you that that's not something to be very afraid of, or it can be dangerous if a horse, like one of my horses, when startling, splays their front feet kind of sideways. And if your feet are near, not even that near, you might get bonked on your foot, which is dangerous and risky for the human, but also for the horse, for the repercussions that then the humans choose to do. So anyway, we have those four clusters: arousal, changes in cognition and mood, avoidance, and those intrusive re-experiencing features. That's really the combo of things that can happen and have lasting impact beyond the initial moment, and continue on past that moment for months, or appearing suddenly a couple of months after you were assaulted, or you thought you were gonna not make it, or something was threatening you financially, in a really impactful way, whatever the trigger is.
Excellent descriptions, Nina. Thank you. It sounds like earlier on you were saying that, so it's not just a life and death situation that can cause post-traumatic stress disorder. There are a lot of different a lot of different things that can be traumatic. And then that I appreciated how you broke down those categories. That's very interesting. And I'm guessing that for people and potentially horses too, that one thing might be traumatic for one animal that might not be traumatic for another. Is that correct?
Mm-hmm. Absolutely. And, more and more, just generally speaking, welfare assessment, so ways that we assess welfare, quality of life in other animals as well as in humans, actually, really are those welfare assessments really start incorporating the understanding that in this case, animals' perception of the welfare issue, like hunger or being cold, or it could be a physical thing, it could be other behavioral or environmental aspects, but the animal's perception, their own perception of the thing is actually what then causes the issue. So while we can have, say, if we use nutrition or eating, feeding behavior as an example, is quite easy. We might see the effects of not enough food, and we know that this has an impact on their physiology, or our physiology, anybody's physiology. But the experience, the overall experience, and thus the impact on quality of life, the animals or our own sense of well-being, is really based on then how does that animal experience that lack of food? Is this associated with other, say, traumatic things that happened in the past? Being not having enough food also is associated with something else. Or is this a situation where an animal's like, oh, weird, my food ran out. Okay, I'm just gonna wait and see here. So that's kind of a very generalized example, but there's that the effective evaluation, emotional evaluation of the individual is really in the end what matters. And with humans, we can ask about it and hope that people can share. With horses, it starts getting difficult, where we still have to assess the behavior. So to your question, Emma, yes, it's the individual experience that matter, and then the individual experience is based on one's childhood or young, fullhood or childhood, what happened early in life, as well as the experiences that accumulate along the way up until, say, if we pretend that this would be a single traumatic thing, like a trailering accident or something like that. It's much more common that there's a cumulative experience of overwhelm in a person's or horse's life, instead of that one visual big thing. But it can be just one big thing. But the experience in childhood or younghood for an animal, as well as the environment that they live in, their housing, their management, their living environment, all of those things, just like with humans, then affect how that particular animal then might experience and assess that life or death threatening event. Of course, again, if we take that trailer accident, if a horse is pinned in a trailer and they have physical injuries, that's a very clear, there won't be a horse that say, oh yeah, that was okay, like that was a clear threatening experience. But, finally, when we think about trauma, especially in humans, and we think about service members in the military, it's not just the traumatic experiences are not just being in active duty, holding a weapon, driving a vehicle, being present. It can also be due to, say, military sexual trauma or interactions between folks in the same grouping or in the same work area. So it's, we want to be careful not to sensationalize that it should be this big thing, because it can be a lot of cumulative experiences that especially horses have in the context of humans, just typically in the course of their lives.
Right. So you could have, using your example from before, you can have two horses living on the same pasture or in the same paddock, and someone forgets to organize someone to feed them for a day, and then you've got your horse is just like, shoot, this is uncomfortable, I don't have my food. And then you have a horse who maybe was weaned too early, or had wasn't fed when it was quite young. And that horse will have a completely different experience of that uncomfortable situation. It could be much more traumatic than your horse who has had food all of its life.
Absolutely. And we could see, you know, we might see lasting effects there. It's very specific to the, say, feeding situation. We might see that food insecurity or food insecure behaviors emerge in one of those horses where we see more food guarding, or we see more aggression around food, or sympathetic arousal around, okay, there's food coming, you know, I have to eat it all, or I feel uncomfortable even though I'm feeding, you know. But, you know, of course, an isolated event like that may or may not have that effect, but might raise anxiety in one of the two horses. And then there might be other outcomes, you know, that kind of clumps together with that overall discomfort around the feeding behavior.
I'm curious, and you've already alluded to this a little bit, just in your description around how trauma impacts horses differently. I know when we talk about trauma in humans that we often talk about the protective capacities that are in place for humans. So again, when we're comparing one person's reaction to another, we're often looking at the resources that they had access to, supportive relationships, hobbies, things that they had access to help them feel well in those situations, and then that will support how they manage those traumatic situations. I'm curious if there has been, in your work, if you've seen, have there been any protective capacities for horses that they will often go to to self-soothe, or, you know, for lack of a better word, resources that they would access in times of trauma that may you know, support them to move through that trauma in a better way?
So overall, so might not be research specific again to trauma in horses, but overall, we know that the living environment plays a huge role in a horse's kind of day-to-day experience. Of course, if we go even further, we know that the weaning timing and method of weaning are really impactful for early development. So, and you know, it's in the United States, at least, it's quite common to wean around the time where a foal starts showing more social interaction and starts interacting more with conspecifics other than their mother, you know, around 4 months. But then we have other countries, other situations, and we have equine pathologists and behavioral specialists who are like, it would be better if it was like 9 months or maybe 11 months. So, you know, we don't necessarily have a good solid samples of these like, especially for large longitudinal studies of horses that just typically would get weaned much later. But anyway, so that early maternal or parenting caregiving relationship plays a big role. But overall, Mira, for your question, you know, the housing or living environment can be a really strong protective factor. So having just your very, very basic needs met of compatible social interactions and social housing, perhaps having a bonded or a horse that you as the horse feel like, I feel relaxed around you. I can doze next to you, just stand and sleep. I can relax with you. We can, you know, eat together without you randomly just going for me, you know, that kind of thing. And having access to fiber for gastric health, and being able to move and have some choice and agency in your just most of the hours of your day. Those things can really buffer or support a horse who might then have traumatic experiences as a default in their training and handling by humans because of, you know, uneducated training techniques, a lot of punishment, a lot of containment, or even in situations where there's medical care needed and there's not appropriate use of analgesic or sedation. There's kind of like a freeze in place kind of effect, but the mental and physical experience of that medical procedure is felt. So it becomes this horrific, like you're trapped there and you can't do anything. You can't, like I was saying earlier, move away from, which is the function of the evolutionary function of those experiences of fear and stress in the first place. So, kind of starting there, it's better to have a good living environment. It's better to, if we use that human comparison again using something called ACEs, ACES, Adverse Childhood Experiences Scale, or ACE would be the Adverse Childhood Experiences, where there were these big longitudinal studies conducted by a health insurance company in the United States about, looking at what was going on for children, and is there a connection to their propensity for mental health disorders, physical health issues, substance use, dissatisfaction with life, things like that later on. So it's almost like you can take that ACEs scale, and anybody can, again, search the internet and find out more, and even take it themselves as a little kind of questionnaire. It's not recorded. The internet ones are not recorded anywhere or anything like that, but it can be good to explore. We can almost think about the opposite, like take the ACEs scale and then think about what would be the opposite of those, experiencing emotional abuse, physical abuse, witnessing violence, or not having enough food, experiencing neglect, so abuse from the withholding or the lack of. So, and then the opposite, good and careful and slow weaning, resources in the living environment, no physical trauma, as little emotional trauma or fear as possible. The horse is not witnessing even other horses maybe being abused. There's an interesting new study by a French team, Lansing and her graduate student, around a horse watching another horse on a screen getting a veterinary procedure. This was an unknown horse to them. And then watching another video, it's a video of a real horse and a human interaction, a horse being scratched by another human, or like a little allo grooming, and that there were effects in the observer horse, like physiological changes measured. And this made me think of the ACEs, the item on the ACEs scale about witnessing violence as well. It's too early to make some sort of causation there, but it just made me think about it. So, I haven't touched on any of the human kind of what humans should do perhaps in their handling and training, but overall, to your question, those can be protective factors: good upbringing, good living environment.
I love this so much. Both Mira and I were looking forward to this interview. So now, what about protective factors and that might, so let's say we have a horse who's already experienced trauma.
Yeah.
Maybe a horse who is who has been sensitized to noise, let's say. That's the thing that we can visually see that's going on. What are some things that we can do to minimize the anxious or stressed behaviors that have come out of this possibly post-traumatic stress disorder? So I'm using the noise sensitivity example, right? Because I could probably imagine, I don't know, make sure that your horse has a spot to get away from noise. Like, what are some of the things that we can do that might help our horses ease their lives a little bit if they have been traumatized?
Right. I mean, we want to avoid re-traumatization, whether we think of ourselves as a trainer or as somebody who does behavioral consulting, or like directly supposed to address the horse. Either way, we want to avoid re-traumatization. And I think one of the most important things coming out of exploring the idea that horses might have these ongoing experiences in those kind of 4 clusters that I mentioned, beyond the immediacy of a few days, or in humans it's up to a month. It's called acute stress at that point. And then if it persists, or if it kind of pops up later, then we start talking about post-traumatic stress disorder. So the D is really meant to signify that there's a continuous ripple here from the experience, not just in the immediacy of it, which is a natural, normal response to an overwhelming, scary thing. So if we then are seeing horses who have these continuous abnormal responses, we of course want to be employing the same ways of working with horses that are science-based and are critically evaluated and really are based on their behavior and their needs, as we would with, say, working with habituation, so desensitization, or using various things like counter conditioning or some operant ways of engaging with something scary and having a new learning about it. But when we see the question becomes when trainers then feel like, okay, I'm using these things, but nothing's happening, or the horse has still these exaggerated startle responses or seem like nuts, really. Why isn't even my good training working here? And that's so coming out of this idea that there could be PTSD in horses might come then a refocus on, all right, how do I then refine, or how do you even start by training or interacting with horses and their behavior in these human situations in a way that doesn't re-traumatize a horse, doesn't cause injury, physical or emotional injury. And some of the things, so for instance, say somebody is already using good desensitization protocols, they're already doing it, and say that there's a sound, and the person is like, okay, horse is afraid of the sound, got it. But it could be that you as the trainer, or you as the human here, haven't considered what the trigger or the association, the memory, the connection to that previous overwhelming event, that you haven't considered all the aspects of it, all the potential sensory aspects of it. And I sometimes use as an example in just I do some rehabilitative farrier work, and I use an angle grinder. So this tool, it makes a lot of sound, really hacky, loud thing. It also does another few things, because most owners think that the horse will be afraid of the sound. But most horses are not so worried about the sound, but they're more worried either about the vibration, so the feeling of vibration from the tool on their hoof, or the discharge from the little dust that the grinder. It's kind of like it's a grinding disc, kind of a sandpapery disc that spins, and that kind of, you can shape the hoof and you can work on more severe rehabilitative cases a little easier than with your nippers and that kind of thing. But anyway, so there's other aspects, sensory aspects to that than just, say, the sound. So back to that example, Emma, of just, okay, you think, okay, the sound, so I'm desensitizing the sound, but there could have been other features of that traumatic memory that you're not desensitizing to, or that you, in the systematic process of that, you kind of left out of, say, the original thing that was scary. Classic example also is well-meaning folks who want to desensitize to fly spray, and because they don't want to waste the fly spray, you put water in a spray bottle instead. But it could have been that it's the particular sound that original fly spray bottle makes, the creak, creak, or it could be the specific smell of that particular fly spray that, the horse won't experience because it's water now, because you're not wanting to just spray expensive fly spray into the air. So the number one, first step would be to really be even more careful about exploring what is the actual trigger, what is the actual thing that causes a physiological and emotional response in the horse of fear and distress. So it's really that's kind of the first thing, like be even better at it, which a lot of folks already are very good at. And then the second thing to do, which is really intimately connected to the neurobiology of trauma, is to again, as competent trainers do, they're watching the horse's arousal levels. Sometimes we think about it as a window, like a window of tolerance. Sometimes we think about it as thresholds or use that word. But either way, what we're trying to verbalize is really a interplay within the autonomic nervous system between the sympathetic and parasympathetic areas, which some have theorized around and refer to something called a polyvagal theory about social engagement, where one branch kind of balances the other. The part of the parasympathetic balances the sympathetic to this optimal, like I am alert, I'm awake, I'm attuned, I'm socially kind of primed. And I can be in that space and I can learn and I can think, you know, and that's true for horses and humans. That's not just a human thing. Like I can access everything I've got here in terms of relating to this experience and not being pushed into the defense cascade where I start mobilizing toward, okay, I'm going to have to do something here. I might have to go somewhere. I might have to protect myself. I might have to retreat. I might have to collapse. And I'm letting my brain just do that because evolutionarily that's been working. So in that situation, also being even with a horse that you think might be exhibiting these kind of really strange, consistent startle, fear, you might think that they have post-traumatic stress. You know, being even more careful about that horse's window of tolerance or them being in that optimal autonomic nervous system state for being engaged and with you, and really not pushing these horses. So if in doubt, some folks are like, oh, learning happens at the edge of the window. Like we have to go further. And that can work super well, especially with horses who have had a really good upbringing. I have a client horse example where this now 11-month, 12-month-old, you know, has had really quite an optimal, very late weaning, very informed handling, and she's a draft cross, which is another interesting thing about us humans and how we might have selectively bred for certain temperaments and propensities, even like accidentally for, you know, traumatic stress, which is a whole nother thing. But we control breeding anyway in horses in a way we don't do with humans. But in this setting with this particular horse, you know, it's like, all right, oh, she's like, okay. And I'm like, okay, well, let's try it. Like I can be a little more like active and say, hey, do you want to, okay, cool. She's like, oh, okay, I did it, you know, versus if a horse who's had these kind of anti-resiliency features in their lives, these vulnerabilities, pushing these horses is not a good idea. None of this, you know, learning happens on the liminal edge of the, you know, learning zones or something like that. It doesn't work well. Same with therapists who work with human trauma clients. So you want to really you're watching if you're thinking about a window or a space, you're really wanting the horse to be right in the middle. You don't want them to start approaching those edges because the experience of that horse, they already have experience exceeding their capacity, and they might have there's like a double, it's both the discomfort of exceeding that plus the mental evaluation of like, when I go into chaos, things get really bad. So there could be this, it's like a double whammy for the experience of those horses. So that's why we have to really keep them within their window, and we do that by having a particular emphasis on relaxation and breaks in our training. So we're training in, like we're basically telling them, all right, it's time to take some deep breaths and in and out. You know, but we can't do that verbally like that with horses. So we have to train in behaviors that can help with, say, deeper breathing, like head lowering, other kind of signs that we're standing at ease ourselves and we're giving them a break. So anyway, those are some of those things that the nuances on top of the things that you should already be doing to help any horse, you know, in your interactions with them.
That's fascinating. Few questions from what you just touched on. I'm thinking about that window of tolerance, and thinking back again to a human comparison, and knowing that how I think of it is on either side of that window, there's either the fight response or the over-arousal, and then of course the other side of that, an over-arousal, could also be freeze response. I'm curious if in your work with horses, how are you assessing how close you are to the edge of that window of tolerance, knowing that there's those two different sides of the pendulum on either side of it?
Right. And, you know, remembering too that any, like the visual of a window or the bars or anything like that, it's just ways to help us mentally think about it. So it's technically, I want to touch upon what you said. So it's technically not like the horse goes one way or the horse goes another way, but it's just helping us mentally to conceptualize that there's ways that the kind of sympathetic parts of the nervous system really kick in, and you have kind of internal high activation while you're feeling afraid, such as fleeing, such as fighting, such as we'll call alert or freeze, where you're in it, you're very much in it, your body's held for a second, but you're not, the horse or you, human, are mentally there, you know, it's just a moment of like stay. Whereas on the so-called other side, just to help us mentally, because there's no sides in the neurobiology internally, it would be that there's an older part of the autonomic nervous system, the parasympathetic, the dampening, deregulating part, that then creates things like immobility in the body, but also like a mental leaving. So you're not like mentally there, like, but you're frozen, like on the other side, but there you start really losing that immediate connection to the reality. Everything is soothing. You might also eventually lose consciousness in terms of a full collapse. You know, you pass out, you faint. So that's, I think, what you're referring to, Mira, when you're talking about basically some say hyperarousal or hypoarousal. And it's really important. It's a super important point that when we're looking at a horse and we're hoping that they're within their window of tolerance, their good capacity to engage and learn and remember and take in and integrate and regulate all that good stuff, we might be so, as humans, be so into this idea that this horse must be very calm and quiet, that we misinterpret a horse basically leaving their mind a little bit. So this is a overlaid feature that can actually happen also without these particular states, called dissociation, or you can dissociate. We've all probably done it when we've been out walking or driving, and all of a sudden we've walked for another half a mile and we're like, oh, I guess my feet were moving themselves because I was mentally like thinking about some big thing. Or when we're driving and we're like, oh, I guess I stopped at every stop sign here because I don't remember getting home. So those are very typical features, but they can also be happening when we're really feeling overwhelmed and stressed. And when we get to those, when the parasympathetic dorsal branch of the nervous system starts kicking in and we start basically nearing what's going to be you losing consciousness, like the complete mental disconnect from reality, then you also have that feature of if you're in something called tonic immobility, the horse might be there, they might be standing up, it's not like they're falling over. But the experience of them from the stress and the inescapability so much that mentally they're kind of bleeding. This is what's sometimes called in humans rape paralysis, or this idea that you're kind of physically, or when you're being assaulted or that kind of thing, that you're physically there. And it can be in an intense interpersonal domestic fight as well. It doesn't, like, I want to normalize these things because I think a lot of folks even listening here have experienced some of these in themselves as humans. So we want to be really careful in horses because we train them to not respond or to not advocate for themselves, which can lead to this experience of the horse it's unescapable, the pressure is too great. They might have been in many stressful situations before, and so the body's like, yes, let's do this thing again. Let's just, it worked last time, I'm here. So the horse kind of just stands and looks completely like a calm, good horse. But you might notice that they keep looking like a calm, good horse, even though something unexpected happened. It's like, a gate shuts quickly or something else, and the horse is still, or people are moving around them a lot or touching them, and the horse is kind of blanked faced. And something I teach sometimes is if you happen to have a treat or a carrot or something fragrant on you that the horse likes, so nothing aversive necessarily, but go for something that's pleasant, and you just gently put it within the very close smelling range. In a typical situation, the horse can smell that as soon as it comes out of the Ziploc way over there. But if you keep it close and that horse is literally, there's no response to that. There's no widening of the nostrils. There's no, there's a carrot there. If nothing happens, that's part of that. The body is basically kind of shutting down a bit to protect the animal mentally and physically from the sense of overwhelming stress and discomfort or the association to a previous thing that they might be experiencing. So, very carefully assessing whether, is this horse looking abnormally calm and good? That there's a thing such as too much of that, or it's maladaptive. It's not appropriate for that particular environment or setting.
Mm-hmm. So that might be one way that we are, of course, well-intentioned, but unintentionally re-traumatizing our horses.
Yeah.
I'm missing some of those signs, right?
Yes, by continuing to, so if a horse, say in this example that I just gave, that say a horse is standing and you've started grooming or handling their body in a certain way, they might have had a history of having a lot of forceful things happen to their body, even either in a medical setting or just by over grooming or over handling. It could have been any situation. They might have been asked to do things in, say, an adaptive riding situation where there was a lot of movement on their body and they still had to be still, but then they had to respond, but then they had to be still, and anything like that. And the horse is standing there and they go into this state where you can do that little carrot test or something like that, or you can just watch their face and eyes. Are they kind of, calm, but sort of looking around? Because the worst thing is to kind of train out of horses to orient to their environment, or try to. It really takes away our ability to assess their kind of being socially engaged and connected. But anyways, let's say they're standing there and they have this kind of strange look, and it looks like almost to you like their breathing is slowing down too, so they look extra calm. But in that case, continuing to then grab on them or handle, then they're even, it's kind of like, the body does this shutdown to protect the animal and us, same thing with us, because the animal perceives that the end might be near, or it's so uncomfortable mentally that, that the animal goes there. So evolutionarily it makes sense, but then we're not supposed to keep grooming. The animal's supposed to then be eaten or die, or we're supposed to then, our life might then end. We're not supposed to then this to go on for a long time, like a human then might keep grooming that horse or keep going at it. So in those situations, we want to back off, wait a little bit, see if we can do something again pleasant that's not intrusive to the horse, and then reassess. Okay, what led to this? Go back to that assessment of what are all the sensory possibilities here, that could have, and that includes, by the way, both the overall state of the horse, which is a combination of their feeling in their body and their mind. So that's when we talk about a state of mind, That's what we mean in humans as well as horses. It's not just one thought you have, but your mental state and your body state together. So horses can have state-dependent recalls or triggers where there's a particular, they start feeling overwhelmed, and then they associate that feeling of being overwhelmed with something really bad happening soon, and then they get even more overwhelmed. This is same for humans. This is not a conscious process, it's not a kind of under volition kind of process. But horses, like humans, can also have postural dependent recall. So a horse that's been in hyperflexion, for instance, or had particular kinds of tack that put particular kinds of like elevator bits or things that put particular pressure points or create particular pressure points in the horse, and with a particular posture can also cause that trigger without it being, say, a physical, like, oh, the horse has nothing wrong with their back. We've checked their back 50 times, but it might have not, that explosive hyper reaction might have not been from, vertebrae being pinched. It might have been from that mental experience of absolute inescapability and a lot of pain on their head, for instance. So postural dependent recall, which I'm borrowing over from human psychology here, or human trauma theory, is also really, really important to consider for the person in that setting.
That's like back in the day. This is not, really, but this is what a lot of people thought of it as body memory when people are talking about trauma and body memory, right?
Oh yeah, yep, absolutely, absolutely. It's kind of highlighting that it's not just a thought or a mental theoretical concept that you have, that it's actually about your body and mind not being separate. And any good, especially as particularly trained human trauma therapist, won't approach trauma as an intellectual pursuit. That you don't have to have those functions to have trauma or to have trauma treatment, which is why this comparative lens works so well here, because we're really looking at tracking the experiences of the body, as well as and the mind together.
I'm wondering if you have any favorite case examples that you wouldn't mind sharing, just any horses that you've worked with that just have really stayed with you over the years.
Who've specifically been, experienced trauma, I'm guessing, or maybe might have rather PTSD, again, because we don't have those diagnostic criteria. We can't really, I haven't personally necessarily applied, developed my own thing and then tried to apply that consistently over the years. But I certainly have a number of cases. So for instance, a horse that I've done both behavioral consultation for or with together with the owner, but a horse that I also maintain their feet. So, so I see this is let me see, he is I think he's a full draft. He might be a draft cross, had a lot of transitions in his life, been here, been there, been everywhere, for a short period of time. Actually was also boarded here where I live, or was with my horses for a little bit as the owner was transitioning this horse back from another facility, but now is sort of down the road. And in this horse's case, the horse doesn't have direct social housing, but has horses on the other side. There's some sort of living environment things that I would like to improve. And of course, we've talked with the owner about, but currently my main job is to come and do this horse's feet. Mm-hmm. And this horse is hyper reactive still to a lot of things in their environment. They can seem unpredictable and a little scary because they're pretty big you know, draft horse, and there's kind of, it can be a quick spin, a lot of like protecting the rear because of the kind of training that this horse was put in another state of constantly facing. So this is of course also a natural like fear protection response. So that making that connection with that training, that's like a whole nother conversation. But anyway, so with this horse, the owner, you know, can sort of catch the horse, but mostly he just lives out where he lives. And I go over there when I do the horse's feet. I go there, I bring my tools, I set up, I halter the horse, I tie him to a tree, and I trim his feet, and then I leave. So that's kind of the situation that I currently engage with the horse in. But so I've habituated this horse to the grinder. So I actually do use the angle grinder when I trim him, even though he is seems to be hyper reactive to a lot of things, or very vigilant and scanning everything. So, but we have worked specifically on the grinders. The use of the grinder works quite well under these specific conditions. So I'm using this case not as a, you know, carefully constructed, like this is my behavior consulting client. We've gone, you know, they put out X amount of dollars for me to come, you know, every week, twice a week for 3 months. You know, a lot of us behavior consultants don't always have that experience with our everyday horse people and their horses. So I'm using this example then to highlight what I do when I'm about to then trim his feet, knowing that he has been habituated or have desensitized him to the grinder, meaning that the grinder itself doesn't startle him, turning it on and off, trimming on the hoof. But when I'm with him, I'm constantly reminded of these principles that we talked about earlier, especially around his window of tolerance or his arousal level, and really looking at the previous associations that he might have had to certain positions that people are with him in. So I'm really watching where I am, you know, my arousal, because he might be my 5th client that day, and I'm just kind of coming on in there, you know. But if I make if he startles with me, it takes him a very long time to come down. And then I just have to sit on that stump and next to those trees and we're just going to chill out a little bit. We're going to take a break. And I'm watching carefully. And sometimes if he's placing his body in a way that he feels comfortable, I then just trim from that perspective, from that position. So sometimes he kind of stands really close to the tree and it's slopey too. So there's like not a flat space. So we're kind of like this. I've got my hoof stand, I'm trying to, you know, but he's saying, okay, I want to stand like this now because something about this other posture is really reminding me of something. So then I go to that position and then trim from there, and that's all right. So it's never about, hey buddy, you know how to do this, just come on now, you got to just stand. You know, I can't do that with this particular horse. So that was I have another example to share, but that was one where I'm not actively engaged in behavioral modification per se with the horse, but I'm actively engaged in handling this horse on a regular basis. And I can still apply those principles. I have actually, one of my horses is a mini. And at the time, a few years ago, I set up an equine center for a humane society focusing on behavioral modification and adoption. So I was contracted just to get it going, so to speak. It was in a different state than where I live right now. But I did the intake on this particular horse. We did four owner surrender horses from that same place. So this mini is about 3 and has had some unfavorable interactions, a bit of neglect, but mostly just direct handling fears. So a lot of grabbing the head and medical neglect, so sores on the face, and they, clearly had a hard time catching this mini. So she had to have her halter on at all times. There was a lot of grabbing and maneuvering from the top. She's quite small. And she's also quite sensitive hormonally, so it could have all played into how they chose to handle her. So because she's been at my place, and technically it's not a professional client, she's my own horse, I've gone super slow with her. And so for instance, in her case, I can work with her in an enclosure where I don't have to have anything on her head, because for a long time, it was so triggering for her for that piece of equipment, even though it was a broad halter. So that's another consideration, by the way, that even though you know that a piece of equipment is helpful or more mild, or, you know, say a kind of bit or some headgear or something, and you know that, you know, mechanism-wise, pressure-wise, this is a better alternative. That horse might have an association to that particular milder piece of equipment, like a bit or something, that causes the wearing of it to be more aversive than perhaps another kind of equipment, a thinner piece of equipment, or something that you think, I want to go to mildest first, but that might not work for that particular horse. And that's one of those situations, especially when we're talking about these lingering effects of overwhelm or post-traumatic stress disorder, where you really have to be watching for these things. So, but anyway, with this Mini, she's comfortable now wearing a halter, but I haven't had her tied until actually quite recently, when I filmed her for this other research project that a colleague of mine is doing. But it's been a few years, and actually it went well. But anyway, so with her, everything has been choice-based. Because she's been smaller, she's been in my care, I've been able to go at it much slower. Because when I'm working with a client horse, I have to consider the setting the horse is in, the people that are working with the horse, and whether that horse might go down the road, and how quickly or not I might have to consider working. But I knew, of course, that with her, you know, she's loose. So if we're working on her feet or her mouth, getting her mouth touched, or her feet, she's loose. It's choice-based. There's some reinforcement, but sometimes she's just interested in being close, like something's happening kind of thing. So she wasn't quite at that level of complete and utter destruction of the human-horse relationship. Also partly because she's quite young, and still a little curious, and maybe didn't have time to get, you know, to a really horrible point. But there, really been able to apply those principles of something I wanted to touch upon, something we call trauma-informed care in humans. I'll mention it in this, I'll just mention a few things in this case, but I'm happy to say a little more about that, because I think it's helpful for people who are around horses who don't think of themselves as trainers or anything like that, to understand what we do on the human side. But here I use some of those principles of collaboration, of choice, of you know, creating kind of a trustworthiness. So always, if I'm giving the signal that we're going to end, or we've set it up so that she can walk away, that I'm not then following her, you know, to continue over here instead. Like, you know, really having to go slow with her, and working in again, a slower, more different way than I might if I have some time pressure due to working with a client. But and finally also my human expectation of her. So I have a number of horses here at home, including a Mustang, and including horses I've had for a long time and shorter time. And of course I work with human-horse interactions, human-animal interactions. I also work in a campus here, an hour north in Denver. And of course everybody's like, are you gonna bring your Mini to campus? Like, your Mini could be so cool. My Mustang will do much better. I actually would like to bring my Mustang to grace in the little, you know, area between the buildings, and I think he would do just fine, actually, based on the interactions and training and experiences that we have. But with Penelope, with my Mini, she still gasps audibly if she gets startled. She sounds like a human. Like she really, but then she comes down really quickly again, but she still has that exaggerated startle response. But in contrast to this other horse that I do his feet now, where if we have gone there, oh shoot, it's going to take a lot. We just have to wait this wave out. And there's nothing I can do to distract or do a seeking activity or search out some sense, or, we just have to wait. So anyway, my human expectation of I have a small horse is also that doesn't mean that this small horse can now be comfortable traveling, be touched by, she doesn't care so much for being touched, and doesn't really enjoy so much certain scratches even. So anyway, the human expectation and adjustment of what I want for my horse versus what the horse will enjoy is a super important thing when we're talking about these lasting effects.
I love that. There's a few things that I think that people can really take out of that. Well, really everything that you've said here. There's a takeaway, but being okay with adjusting our goals with our horses, not personalizing their reactions, being patient with their process, watching body language, as well as not assuming that because a method or a tool is gentle, that it's necessary that the horse is seeing it that way.
Exactly. Even if you've got all that good science, it could be that they've associated a certain feeling of a certain piece of equipment, that's the trigger, not the equipment's mechanics in itself, And I think really, as we're talking about takeaways, there's a framework on the human side called trauma-informed care. And this means, this is not just for those who are therapists like myself and treat people, like the actual addressing of trauma, which typically has to do with regulation and memory or memory processes, and then kind of meaning making around experiences, things like that, that when you're doing like direct trauma treatment. But in other care settings, healthcare settings, schools, workplaces, these trauma-informed care principles can be applied. And I think this would be a good crossover for any person who's handling horses or training horses, not just interested particularly in post-traumatic stress, but these principles really emphasize things like, first of all, knowing some of these symptoms. So knowing that, not being an expert on them, but knowing that these kind of some hyper exaggerated startles or other of these features that we talked about, something that seems like weirdly out of place, or other stress and anxiety behaviors, that these could be not the horse being bad. And this is the conversation that we're having in any part of the horse industry. The horse is not being bad. The horse is not out to get you. The horse is not saying, I won't do it because you're blah, it's really, the horse is maybe experiencing symptoms of a traumatic event or from, stress. And then knowing that this is quite prevalent. That's another part of the trauma-informed care principles on the human side, both in ourselves, as well as then, in our case, interspecies, maybe our pets, maybe, our horses, maybe our colleagues, maybe our co-trainers, maybe our clients, human clients, recognizing the prevalence, and then resisting re-traumatization. So resisting pushing through, resisting violating that person, resisting going for that, they're just trying to irritate me. They're being disrespectful. They're not respecting my role, my power, resisting those things. And then there's all these, I kind of touched upon them earlier, like creating a sense of safety, but knowing that the other is the one that actually confirms whether this is safe or not. It's not I made the perfect safe environment and you're being ungrateful. Like, it's the other's assessment. And then we call it voice and choice with humans. So knowing that your voice, you're verbalizing, you're expressing, or body language expressing something that matters. You might not be always in a position where you can 100% control your environment as a human or your setting, but that your voice matters and that you have some choice, voice and choice. And then things like being trustworthy and keeping boundaries, keeping promises, as I mentioned, trying to collaborate with. And these are principles that, again, are like, work well in any setting when we think about horses. And interestingly enough, in the trauma-informed care principles, social support or peer support on the human side is also highlighted, which can make us remember, that's right, our horses need to have conspecific peers, other horses that they can have a good living environment together with. And because the biggest barrier, and we see this also with human clients, not just with horses, when we, like you were saying, Emma, we start doing this thing where we personalize what somebody else is experiencing. And we're so worried about cognitive dissonance in ourselves that we might be, again, I as a human practitioner, I could be re-traumatizing my clients. Like, oh no, if I even acknowledge that, it makes me feel so bad that I'll pretend that that's not even possible, you know. And that same mechanism, of course, happens with horses. And I was recently having this interaction with one of my equine behavior students where she was saying, yeah, no fear, no harm. Like, those are really good principles for horse training, which I agree, you know. Yeah, we don't want fear, we don't want harm. The problem is that if we say, here's good horse training principles, no fear, no harm, people are like, excellent, because I certainly don't harm horses. Mm-hmm. I don't scare horses. Like, I'm already doing it. Cool. You know, so it's like, that's why it helps sometimes to have some human psychology knowledge, because then we can see that if we say, okay, no fear nor harm, the acknowledging that we might cause fear and harm is that kind of threshold is so hard to get over with cognitive dissonance that we say, well, then I don't do it. Of course I don't do it. And the horse is not telling you any different, you know, especially in populations, vulnerable populations like children and horses, older folks who are not able to advocate. So anyway, the human implication here is really looking at languaging and things that can help somebody recognize these things, like those trauma-informed principles, or using things like least intrusive, minimally aversive, you know, like the Lima framework by Friedman, that kind of implies that, yes, there's things that are intrusive and aversive that we do, and that's okay. We want to minimize that. We want to do harm reduction, less of. So, you know, the human factor is something that I think a lot about also in these situations.
I feel like we could just go on for hours talking about this topic. There's so many things, but I am mindful of the time, and you've already just touched on so much. Emma, is there anything else that you wanted to touch on in this interview?
Absolutely everything. I think we might have to steal Nina for a part 2.
I was just thinking that as well. There's just so much to go into with this topic that even in an hour and a half, I feel like we haven't even scratched the surface.
Yeah, and I'm thinking, you know, we haven't, the inclusion of horse interaction human trauma treatment, like that's a big topic that we can talk about too. So I think we'll put that to the side, and then we will send Nina chocolates and cookies and wine to try and get her on the podcast again. Nina, is there anything that you think that we didn't, anything briefly that we didn't cover, or anything that you really want people to take away or think about, any important questions that we didn't ask you about before we kind of wrap things up?
No, really. I mean, I've so enjoyed this conversation, and what I hope is that when we've talked about these things like human trauma, that it becomes a little more like, oh, this is also part of me as a human. Like, not everybody's had, you know, really startling, overwhelming experiences, but might have had elements and bits and pieces of things that might sound familiar, and that's okay. That's part of being a species member of the human species. And in fact, something that we share with other mammals. So we can have this a connectedness, a comparative perspective here to understand us better. And sometimes it might actually be easier to really recognize things in the horse first, and then kind of maybe come back to ourselves that can feel a little sensitive, a little vulnerable, but knowing that with some adjustments for species, specific features, that a lot of these things can really be normalized or really be understood in the context of our shared experiences.
Wonderful. Now, Nina, is there any, if people want to contact you for a lecture, or do you have social media or an email address, or any way that people can get a hold of you, or would you prefer your privacy? Plug yourself if you can, or if you want to.
Goodness. Okay. I'm super interested in connecting with others who are interested in trauma in horses, the experience of trauma in horses. I have so many good personal friends, colleagues from all over the world, in Europe, in Australia, in Canada, who are all very psyched on this topic and have, written books or also do trainings and are, excited about it. So there's a lot of good folks also to reach out to. And you can also contact me. You can either contact me through Facebook if you use it. My profile is public, or I'm set on public, and you're more than welcome to send me a message through Messenger. I'm sure that somewhere we can maybe post my university email address. You're more than welcome to contact me there as well, with your ideas and interest and what you want to collaborate on, how we can support each other, because this information is there, and it's just a matter of kind of helping folks be reached by it. I do a number of workshops and clinics and talks and things like that on the topic. So always happy to share.
Wonderful.
Thank you so much. This has just been such an incredible conversation. So many things that I feel like are rattling around in my brain. And I do hope we can do a part 2, because I know that I'll have more questions as well.
Mm-hmm. Well, I think, Mira, I think that's a wrap, hey?
That's a wrap.
All right.
If you want more Friends on Horses, you can find us on Facebook at Friends on Horses Podcast. Check it out for all the latest and greatest horsey news. You can find us on the web at friendsonhorsespodcast.com
or Instagram at friendsonhorses_podcast.
Like what you hear? Help us quit our hay jobs by supporting Friends on Horses. You can support us by rating our episodes on iTunes,
becoming an ongoing sponsor through Patreon,
or simply by spreading the word about our show.
Have some feedback?
We'd love to hear from you.
Contact us via email at friendsonhorses@gmail.com.
Thanks for joining us.
Until next time.